Necessary Blackness Podcast is independently owned, and we do not accept sponsorship dollars from corporations. We are supported by the people such as yourself who know that in war, the first casualty is the truth. We are at war with racism and white supremacy. We must continue to tell the truth. Support us by purchasing your Necessary Blackness t-shirt by sending an email to necessaryblacknesspodcast@gmail.com.
Hi, I'm Dr. Mia Walker. I am a chiropractor. I practice at Peachtree Center Rehab, and my own practice is Dr. Mia Walker Chiropractic. I am a native Atlantan, native Georgian. I graduated from the University of Georgia and Life University College of Chiropractic. I got into chiropractic because I wanted to help people. I was inspired by many doctors, dentists from when I was a child, and I always knew I wanted to help people, but I needed a different path than going into medicine. So I found a holistic approach that worked with me and my beliefs, and that's how I became a chiropractor. And it is very important for those people who look like me, not only a black woman, but I'm black and I'm a woman, and there are a lot of my patients who come in and say, I was specifically looking for someone that looks like me, somebody who'll listen to me, who won't dismiss my symptoms as something else or just kind of run roughshod. They want to give back to the community because they know that they're giving to me. I'm going to give back to the community in my donations and in my support. So it really is important, and I don't think we've had that for a while, because I do have a lot of people who came up and said, I didn't know there were black women chiropractors. I'm like, are you kidding me? Well, who do they see? In advertisements, they only see white chiropractors, and we don't do as much advertising on TV as you see lawyers and whatnot. So when they see somebody, they Google. And I had one patient just recently tell me, I Googled and I found out that you were a black female, and that's why I chose you. But I don't discriminate. Anybody who wants to come to me, I hope they're coming to me because they can see that I'll take good care of them and that I do care about them, and that it's not a monetary figure to me. So it is important, especially nowadays there's a lot of opioid problems that are going on, and so chiropractic, holistic medicine, we're trying to get to the forefront of that to get people off of prescription medications before it becomes a problem. We want to get to the root of their injuries before it becomes a chronic issue and where they have to take medicines and become addicted. So we're working with the government, the VA, to get people off of drugs and to get them into chiropractic care where it's a natural alternative. We can fix the problem immediately and get them back to health. As far as your question about black women and this, I guess, the stereotype that we're so strong, we can take anything. And when it comes to the medical community, how often we are ignored when we are asking, when we're telling them, I'm in pain, I'm in, something's not right, I'm trying to tell you, and you got all these doctors who are like, oh no, you're fine, you can take it. We'll see about how you're doing in an hour or two. And there have just been too many cases in the news. Serena Williams, here she is. She knows her body. She knows she has blood clots. Here she is in labor. And she's telling them, I just delivered this baby. Something's not right. I don't feel like I'm breathing properly. And nobody would listen to her until a black nurse came in. She talked to the black nurse. The black nurse said, okay, I'm gonna upgrade this. We've got to get you. And they saved her life. This is Serena Williams, the GOAT of tennis, and they ignored her. And then you look back at, I believe it's Judge Hatchett's, her daughter-in-law. She's bleeding out, and nobody is, you're fine. No, she's not. She's dead now, and her child will never know his mother. It makes me angry, because when did we stop being considered for what we're saying when did our words stop meaning anything? When did we get this image that, we can take anything, you can do anything to us, and it carries over not just medicine, it carries over into real life when you're out there and the police are throwing our girls around like you would never see that same behavior with white children. how our children are no longer considered children. They're always aged up to men and women. No, they're children. And so it makes me angry, and we have to be so nice and polite in society, but internally I'm boiling. It's like, I know we have to be diplomatic about things, but when it comes to women's health, we're already considered lesser than men. Then black women are considered lesser than ordinary other women. So it makes me mad, and I'm glad that when my patients see me, they see someone that they can relate to, who can relate to them, and they trust that I'm going to do the best for them. And that is what I want them to know. Hey, I'm listening to you. Don't ever downplay any of your symptoms with me. Don't ever say, well, I know. No, I understand what you're saying, and I'm going to take into consideration everything that you're saying in your treatment, and you're not going to get less from me because you are a different color or because you're a woman. So that's why I do. When people tell me, hey, I'm so glad I found a black chiropractor, a black woman chiropractor, because there are a few of us in the state, but we're trying to make our voices heard more even in our chiropractic association. We're trying to show that there's more diversity in its leadership, and probably get in trouble for that, but that's the truth. We're trying to make it so that it is not all the voices we're hearing are white males. It's not, because there are too many people out there who are coming to us who are women, who are minorities, and they need to have their voices heard when it comes to these issues as well. When people ask me if chiropractic care really works, I usually give them my personal story. When I was younger, in my 20s, I would have a lot of seasonal allergies. Every March and October, we knew I was going to be out for a week, sore throat, headaches, just low energy. And when I started chiropractic care, when I was in school, we were required to actually go to clinic. We had to have a senior clinic, and we would go in. So I was going in, and all of a sudden October came by, nothing happened. March came by, nothing happened, and the light bulb kind of went off and said, wait a minute, I'm no longer having seasonal allergies, so why is it? And it's because I'm getting regular chiropractic care. So I knew from personal experience that it worked. And then when I started in clinic and started adjusting my own patients, it's that instant feedback you get from people who come in and they're saying, either I was in a car accident or I woke up with this crook in my neck, and I've come in to see you, you've done your testing, you've done your therapies, and now you're adjusting me, and all of a sudden this pain is gone. I don't have it anymore. I'm not feeling as low energy as I was when I came in. I'm not having that stabbing pain. So when people ask me, does it work? It works, because we're getting to the root of the problem immediately, and we're not kind of masking it with pain medication. We're going directly to the cause of the problem and correcting it. With the allergies that I had, the clinician who was seeing me, they checked my whole body, and they found that there was one section of my body that was in my neck where the nerves were not conducting their information to those parts of my body to say, hey, let's correct this, let's fix this. She's having these seasonal allergies. My sinuses were swelling, they were cutting off, they're putting pressure on the nerve roots. Things weren't working the way it is. Because in chiropractic, what you learn is that your brain is basically a telephone hub, and your spine and all the nerves that go off to your different organs, different muscles, that they're communicating information from your brain. So if that communication highway is kind of cut off, then other things happen. And so with allergies, the allergic reaction that is created in the body was cutting off that communication from my brain to my nerves. And so once I started getting my neck adjusted, things were being put back in place, the highway was open, and my body was able to not only fight off the allergies with the proper response, everything else started feeling better. It wasn't just my neck and my nose and all those other places down in my lower back was feeling better. I was able to function better because I was not laid up sick with this problem. And before, all I would do was call up my medical doctor, and he would just prescribe something, and it wasn't getting to the root of what the problem was. And so that's why chiropractic is most definitely it is it's alternative medicine. And then when they say alternative medicine just means that you're not using pharmaceuticals.
Yeah.
Acupunctures, chiropractics, we cannot prescribe any medications. So everything is done holistically through the body. And with chiropractic, we're adjusting the body to open up the neural pathways so that nothing is kinking off those nerves. So for us, we're using your body, trying to put it back into its optimal place so that you feel better and you don't need to take ibuprofen or anything else. And that's not to say that those things don't work, because I would be a hypocrite if I said I never use those things. I do. If I have a headache and I can't get to a chiropractor to adjust me, I will take it because I have to be able to function. So I would never say that don't ever take medication, don't ever do that. I'm not gonna. That's not the type of chiropractor that I am. My belief is, though, let's get to the source of the problem first. And if that's not the cause of it, I can't fix it. I will always refer out to someone else who can. My thoughts on our community returning to its roots. And we have to think about the fact that we don't have the long history that especially African Americans, we don't remember anything about our culture prior to being brought over here. So whereas other cultures have this rich history that they can reach back and say, oh, this is how they used to do it back in the old country, we're just now learning those things. We're just now coming into it. And I think it's great. I think it's wonderful that people are embracing, veganism or, eating better. It does help you. I have cousins, I have friends who've taken that route, and I have a lot of friends who listen to Dr. Sebi and are taking hold of his research and what he brought to our community, and they are adjusting their lifestyles, because let's be honest, we eat too much salt, we eat too much fat. And if we can turn those things around and not have that dependence on all these high blood pressure, high cholesterol drugs, because there's a lot of interactions with those drugs that are making us sicker. You see it in the small print when they're telling us about all these drugs. You can see it it may cause liver damage, or it may cause your kidneys to fail, but hey, it'll help your heart. Instead of just eating better, instead of just cutting back on the fat and the sugars and all the other things that break your body down internally. So I think it's great. I love the fact that there's more options for us other than fast food and other things. Me personally, I'm not really into conspiracy theories, but I do know that it is kind of strange that there are a lot of these doctors that this is happening to, and it's not just a lot of doctors. There's a lot of judges that we've seen who have mysteriously and who's going to investigate? To be honest with you, other than us. If we don't investigate, how will we know? Like I said, I try not to buy into conspiracy theories, but I do too many coincidences. And I wouldn't put it past Big Pharma, to be honest with you. They make a lot of money, and they control a lot of, unfortunately, their money goes into our government, and our government, and the AMA and all these other different organizations, they depend on them. So I wouldn't say that that's out of the realm, possibility that some of these doctors may have gotten too close. You can look at Cuba. Cuba right now has developed a way of preventing HIV transmission from mother to child. Why is that here we are in the United States, and we have the CDC, and we have all these other... Why isn't that we're able to do that? Why is it that it takes this little country that supposedly is so backwards, yet they're making all of these medical discoveries that are not being done in the greatest country in the world, supposedly. So I wouldn't put it past, but I don't know. I need a little bit more information, but it does kind of like, I ain't right here. All of these doctors. But yeah, my aunt and my cousin, they send me all of these things about, this is a conspiracy. This is something that's going on. And, you have to have an open mind about everything. Conspiracy theories are not my thing, but I'm going to listen when somebody's presenting information because, it could be true. there's a lot of money out there, and there are a lot of people who make money off people being sick. We have a new initiative for community and wellness pop up that we're going to be doing, that we have been doing. We work with churches and other businesses whenever they're having health cares we want to be involved with. We speak to our patients, tell them, hey, if you ever have a health fair, if you ever have anything where you can invite us into, we want to be able to come in where we can do table massages, we can do spinal exams, we can talk about anything that you want to talk about as far as your health. And so we do encourage our patients as well. Hey, don't forget us if we're out there. And then we do some on our own where we go to the community and we set up and have people come in and, hey, come in for a visit, come in for a checkup. You got backpacks for kids when they're going right back to school. We fill them with different little items and everything like that. So you have to get back to the community, because the community is going to remember you and come and see you if they know that you care about them, outside of, hey, just come in Monday through Friday, don't worry about Saturday and Sunday. But if we're saying, hey, we're going to pop up here, we're going to be doing this short little thing, can you come in? They're gonna remember you more as that doctor who cares about them, outside of just seeing them as a patient during the week. So I do like doing those, because it not only introduces me to my patients and their families, they can bring other people and I can meet those folks as well. And shameless promotion time, the way you can find me is on Instagram at Dr. Mia Walker Chiropractic, on Facebook, Dr.Mia Walker. And those are our two social media platforms that we really like for people to come see what we're presenting. We present a lot of information on nutrition, on health, positive mental attitude. So if you come to our Facebook and to our Instagram, you'll see a lot more about me and about the practice.
Necessary Blackness Podcast is independently owned, and we do not accept sponsorship dollars from corporations. We are supported by the people such as yourself who know that in war, the first casualty is the truth. We are at war with racism and white supremacy. We must continue to tell the truth. Support us by purchasing your Necessary Blackness t-shirt by sending an email to necessaryblacknesspodcast@gmail.com.